I'm a lead nurse in a pain clinic in Norfolk. I've been a pain specialist nurse for near enough 25 years, so I've got a lot of experience of working with patients and people who live with persistent pain problems. And our pain services are very different from region to region. So some will be attached to local hospitals, others are more based within the community. And the team that you might meet in a pain clinic is also very varied, but can include anything from medical doctors, specialist nurses like myself, physiotherapists, psychologists, psychotherapists, occupational therapists, and pharmacists, or any combination of any of those. So depending on where you are living, you may have different style services, but we all have a background in helping people who have long-term pain conditions to try and help them to move forward with managing their pain for themselves in a more effective way. So I'm going to talk very much from my personal experience, but we accept referrals from any healthcare practitioner, so it doesn't have to be your GP, um, but it needs to be somebody who knows you quite well, I think. And I think the important thing is to understand what a pain clinic's likely to have to likely to be able to offer. In our pain service, our starting point is to offer um, a a patient who's referred to us um, uh, a a discussion and a sort of assessment of the pain situation that they're in. That is a physical examination for some people, but also there's an awful lot of questions of talking about how pain affects you physically and emotionally. That will either be done in our service either by a senior non-medical practitioner such as myself, but also one of our pain may also be one of our pain consultants. And what we try and offer is an understanding of why the patient or person sitting in front of us is in pain in that sense. We try and put that into context of their underlying disease or whatever, but try and explain to them about the persistent nature of pain, and that unfortunately not all pain conditions are going to go away in the same way as we would think they might. And at that point, we would then try and create a management plan with the patient. We would rationalise medication. And I would emphasise that near the majority of patients that come to pain clinics probably find themselves discussing their current medications and reducing and stopping the ones that aren't really having any benefit. We don't have individual drugs that are only available if you're under the pain clinic. We use the same drugs, but we probably have a bit more experience as to how and why they're likely to help and whether or not they're going to be useful. And at that point, then, we have a wide multidisciplinary team. We might think that somebody's activity and exercise advice needs looking at through our occupational therapists, our physiotherapists. We might recognise that people are really struggling with the psychological impact of pain. So we might involve our psychologists. We do lots of education programs. We run psychology-based education programs, physical exercise and activity programs, sleep management programs, relaxation programs, and for people who are really struggling, we might offer a pain management program, which is a combination of all of those things. So 10 weeks of about 3 or 4 hours a week, looking at exercise, activity, pacing, psychological effect, medication, and all of those things combined. Because often those bits, if we go back to that jigsaw, the important bit is that if there are pieces missing from a jigsaw, we always know how frustrating it is when there's a missing bit. So we're trying to put those bits back together to try and help people move forward and take ownership of their pain, to understand that they can make those changes and that we're just there to support them.